Hi, I'm Dr. Andrew Plummer. Welcome to Spark Eye Care. This video is going to help you navigate the process of cataract surgery. It's part of a series of videos that you can find on our YouTube channel. Briefly, when you have a cataract, the natural lens inside your eye has turned cloudy, and it makes it harder for you to see. The only solution to this problem is to perform cataract surgery, where we remove that natural lens and replace it with an artificial lens implant. We're going to walk you through everything that you need to know so that you can get the very best possible results from your cataract surgery. This whole process takes several office visits and multiple weeks, so for this video we're just going to focus on the pre-op evaluation and the surgical plan. When you come to see us for your cataract evaluation, first you'll come to our office for a complete and thorough exam. We're going to perform lots of testing to make sure that we have a full understanding of your eye health so that we can make good recommendations for your surgery. We'll check your vision, your eye pressure, your glasses prescription, and we'll dilate your eyes. We use eye drops to make your pupil bigger, which gives me a better view of your cataract and the important structures inside your eye. As a side effect, these drops can make your eyes very sensitive to light, and they can make your vision blurry. Usually this lasts about 4 to 6 hours, and we can give you shades to go home with after your visit. You should think about whether or not you'd like to have someone drive you home from your eye exam with your eyes dilated. When in doubt, it's usually better to have a driver. Once we've finished your exam, you and I will spend some time talking about your cataracts and the options you have for your vision after surgery. During your cataract surgery, we replace your natural lens with an artificial lens called an intraocular lens implant, or IOL. This lens lasts forever and the cataract never comes back, so this is a once in a lifetime surgery. There are lots of different IOLs made by different companies that have different features. Which lens you choose is going to determine how you see for the rest of your life, so we really want to get this right. To keep things simple, here are the three main categories of lens implant. The first is the basic lens, and this is going to be the most affordable because it's covered by medical insurance. With this lens, you can choose to prioritize near or far vision, but you can't have both. This lens also won't correct astigmatism, so my expectation is that patients who choose this lens are going to wear glasses. With glasses, you can achieve A or even A plus vision, but without glasses, you usually end up somewhere around a B. The next option is astigmatism correction. Up to 50% of people have astigmatism. If our measurements show that you would benefit from astigmatism correction, then this is a very easy recommendation to make. Like the basic lens, you have to choose whether we prioritize far or near vision, but you're much less likely to need glasses at that chosen distance. There are no downsides or side effects to this lens, so it's the best choice for many people, even those who have other eye conditions like glaucoma or macular degeneration. You can expect A to A plus quality vision without glasses with this lens, but if you're like the majority of people who choose distance vision, you'll still have to wear reading glasses. The last option is range of vision. This group of lenses aims to give you glasses-free vision for far, mid-range, and even near vision. It can also correct astigmatism, so most patients who choose this lens won't need to wear glasses after their surgery. These lenses work by splitting the light that comes into your eye into different focus distances. They're really the most advanced technology available today, and 98% of patients are really happy with this choice. But no lens is perfect. There are some trade-offs that you need to understand. Most of these lenses will cause a slight halo effect at nighttime, and even in daytime there is a slight trade-off where you give up some of the vision quality in order to gain range of vision. For example, you might have A or A minus vision for far away instead of A plus, but you won't need readers to see your phone. You might still need a weak pair of reading glasses for reading fine print or threading needles from time to time, but day to day, most of my patients aren't wearing glasses after this surgery. In general, your choice of lens boils down to a simple question. Is it more important to you to prioritize the quality of your vision, even if you have to wear reading glasses, or are you willing to deal with a slight trade-off in quality in order to have good to great vision at all ranges? If quality is most important, then you should probably choose the astigmatism correction option. If you want to be free from glasses or you want the most advanced technology available, then range of vision is the best choice for you. Once I've gotten to know you, I'll make a recommendation about which lens I think is best for your eyes and most likely to make you happy. We'll go over things like insurance coverage and cost. And pretty much all medical insurances will cover the cost of cataract surgery with that basic lens. Astigmatism correction and range of vision will cost extra out of pocket, and we'll review those expenses during your visit. We'll also talk about the next steps for your surgery. At this point, we'll pick out your surgery dates. Usually, we schedule each eye for its own surgery date 1 or 2 weeks apart, and you'll have some post op visits in our office 1 day, 1 week, and 1 month after your surgery. Before moving forward with surgery, we'll have you come back to our office in 1 to 2 weeks to measure your eyes again and finalize our surgical plan. During those 2 weeks, I want you to work on dry eye as much as possible because dryness is the #1 cause of blurred vision and bad measurements after surgery. At a minimum, I want you using quality artificial tears 3 to 4 times per day in both eyes. You should also use a warm compress over your eyelids for 5 to 10 minutes per day. If you have really bad dry eye during your first office visit, I'll talk to you about other treatments that we can do to get your eyes back on track. It's often worth taking these extra steps for the sake of getting better results from your surgery. Just know that treating dry eye is super important before and after cataract surgery. It really does make a big difference if you work on it, so please don't skip this step. It's also important to note that if you wear contacts, you need to let us know and you need to stay out of contacts for at least 2 weeks prior to measuring your eyes. Contacts will change the shape of your eye and throw off our measurements, so staying out of them gives your eye time to return to its natural shape. LASIK and other refractive surgeries also change the shape of your eye, so make sure you mention these so we can adjust our calculations. When you come back for your measurements, we'll finalize your surgical plan and your IOL choice. We'll verify your insurance coverage, collect payment for any out-of-pocket costs or charges, give you your post-op drops, have you sign our consent forms, and will confirm your dates for surgery and post-op visits. At this point, you are officially ready for cataract surgery. I know that this can be overwhelming, but hopefully watching this video has given you a roadmap so you know what to expect. My advice to you is to remember that the choices you make for your cataract surgery will affect how you see for the rest of your life. So it's worth investing the time and resources to get the very best possible outcomes. I promise that I'm going to take care of you the very best way that I know how, and I'll make sure you have a great experience. Check out our YouTube channel for more videos about the steps of cataract surgery, and hopefully I'll see you soon. Thanks for watching.